Okay. Hi everybody, my name is Arnold Slominski from Active Rehab Center, and we record a short video about some of our patients and their experiencing what they experience in Active Rehab Center. And I'd like to introduce Karen. Karen.
Hello.
Hi, and Karen is one of our patients, as many. She came to us with a condition after left ankle fracture, and she had some experiences in Beaumont Rehab. The doctor showed the X-ray and everything looked really good in the ankle, and apparently she was told by a therapist there that now everything is good and she should walk normally. The reality was a little different, and somehow happened that Karen found us, and we really had to put a lot of work into this ankle to make it better. We got the ankle to maybe 70–80% to where it really should be, and now we discovering in the process that this ankle function or full function of this ankle will depend not only on ankle itself, but also some other body parts like her hip. And what came up in the process of physical therapy, that her hip had, for whatever reasons, a lot of limitation in mobility, and as a result it was affecting not only her ankle but also her knee, and very big possibility that the ankle fracture happened because the hip didn't have full range of motion, was very tight, and not only the hip but also a lower back hip complex, what we called, and not that we didn't know it before, but the severity of a problem and after the foot fracture involved us as therapists so much with the foot, so we had to spend a lot of time daily on that ankle to treat a local problem, and then when the foot was improved enough that we could look beyond the box, we started to look what's going on further with the body to bring the body to a normal function. So the point is that people who come to us, we trying not to only to decrease the symptoms like pain, swelling, inflammation and other symptoms. We not only trying to build compensation for the patient, but we just trying to bring the patient to as normal function as possible, sometimes reversing changes which accumulate in patient's body for many years. And right now we are at the point where we're working on the hip lower back complex in order to further push the foot function to complete normal. So I'm leaving you now with Karen, who may have some other point of views and her own experiences experiencing by herself, and how she will express it. It's depending on her. So she will tell you a little bit what is happening here for her.
Yes, I'll be happy to share with you. I've been going to doctors for about 40 years with a sore left leg, lower back, and the femur joint left side, and the SI joints lower left side. No problem. Well, maybe surgery would help. Well, I never would get surgery because I know intuitively that wouldn't work out. So like Arnold said, I finally broke the leg just by stepping off a little bit of a curb. Obviously due to the left side always being so tight. All the joints were always tight. Well, then I started coming here in October, and after about 2 months, Arnold was, measuring the legs. Wouldn't you know, the left leg, the bone was shorter. So he said, wow, you need to go get a lift to put in your shoe, 1/4 inch, 1/2 inch. And so a doctor should have found that, but no, they didn't. Make a long story short, I came here because I broke the ankle, got out of the walking cast. Dr. Beaumont said, no problem, you can walk. Well, I couldn't. I had to have a walker. My foot didn't have any feeling in it. But they insisted, oh, you can walk. Well, physical therapy. So then I started, well, come back in about a month, we'll send you to physical therapy at the hospital. Well, I knew better than that, so I looked in the phone book and found Arnold and came here, and he started working on the foot and the ankle. Then he found, whoop, the left leg, the bone is shorter, that's how I was born. Whoops, now the left hip joint, he's doing something about it without surgery. And like I say, it's been going on for 40 years. So I just really appreciate Active Rehab. Plus he makes me exercise at home. Leg swing, stationary bike, weight training to regain strength in the lower extremities. And I'm very thankful for that.
Right, and what I want to say, Karen, that not everything is so obvious right away to people. So in the process, we found that the actual length, bone length is shorter by maybe 1/4 of an inch than the other leg. So in this case, her left tibia bone was shorter. And that is absolutely calling for a shoe lift, because there are other situations which will not call for a shoe lift. And then I will record a separate video to telling people when there is indication for shoe lift and when there are no indication for shoe lift, even though there is a certain leg length difference. In this case, since one bone was really shorter, it was indicated that we even it up with the shoe lift, and that was helping with biomechanics of the leg. And perhaps one of the changes in the bone length was contributing to her hip and lower back problem as well, because the body is unbalanced for many years. Maybe since you were born and you were not aware of it, because your overall condition was pretty good. So body has unbelievable compensatory capacities. So that means that if the body compensates, we don't know that something's wrong. So we don't know until a certain point. And Karen in her life got to the point where the tightness and compensations.
Short leg.
Right. Short leg, compensation, tightness led to the situation where she just broken part of her ankle bone, which in this case was fibula bone, just chipped off, and most likely due to a lot of tension of tight muscles, which were too tight and causing a lot of tension on the bone. And that's how bone in that particular position where she flipped the ankle outside was just was too weak and part of the bone chipped. Now that's only speculation whether it would happen if she didn't have a shorter bone, if she didn't have a problem with the hip or lower back prior to it, and it will remain a speculation, but it's most likely that those type of a condition influence other body parts like her ankle in this time. So that's why since it was very tight, very involved, we spent a lot of time just on the local ankle just to improve mobility, proper movement, as well as strength as much as we could. So now we're working farther, like beyond the box, as I said, which is more outside of the ankle, which is a knee, hip, and lower back, in order to bring possibly the fullest function to this body part, which was originally injured. I don't know if you want.
And may I also say that I come here because I want to, by choice. I have no health care insurance, so I'm paying for this. And I've not been able to work since this happened in July of 2012. But it's worth it, obviously, because if I'm paying for it, then it's got to be worth it.
As a matter of fact, Karen didn't want to do that until I just explained to Karen that we do it for other patients, because that's one of the best way to show what we do, and we don't really prepare it. We don't prepare it.
Yeah,
right?
I don't have a scripted, and I'm not a public speaker.
And neither I am. Neither am I.
Yeah.
So we do a lot of mistakes as we speak, but it's real life. It's happening right now, and
speaking from the heart, from experience. So if there's anybody out there, even if you don't have to see a doctor for something, but if you've got a pain, you've got nothing to really lose by coming here and having Arnold, see what the flexibility is, range of motion. Because like I said, the doctors couldn't help me for 40 years with my lower back and my left side being stiff. They couldn't even think about the bone. And I've had x-rays recently as last summer when I broke the ankle. They did all the x-rays. Couldn't they see the bone was shorter? Nope.
So maybe one more important factor is that we here in Active Rehab Center, all employees are really focused on the patient, and we really are trying to work with the patient for the patient, and utilizing our knowledge and our skills and give the patient the most we can in the given time we have for the patient. So the willingness really to help somebody is what I believe is important, because it builds the patient relation, but primarily it helps the patient to recover much better than somebody who does just that for a living, right?
Right. And we have lots of homework. Every day stretches. All right.
Thank you so much.
You're welcome. You're welcome. Thank you.
Thank you.
Hello, hi everybody. We've been treated by Mr. Arnold Active Rehab Center in Shelby Township. They are very great provider, and we appreciate their business. So they're very kind and they do the job right and nicely. So that's my family, my children, and my lovely wife.
New wife, our old wife is in heaven.
And we could say hi to everybody. All right, thank you. God bless you.
Hello, my name's Ed, and welcome to physical therapy. And there's great people here, it's great therapists.
Pani Wanda Fleszar-Zych, prezeska Koła Seniorów przy Parafii Matki Boskiej Częstochowskiej. Jestem pierwszy raz przed kamerą, więc proszę mi wybaczyć, prawda, małe zdenerwowanie, ale jestem tutaj w Active Rehab Center na Open House u Państwa Słomińskich i chciałam podkreślić, że jest bardzo piękny zakład, nowocześnie urządzony, odremontowany, najwyższa technologia we wszystkich urządzeniach, jest bardzo dobre przyjęcie, jest sporo osób z naszej parafii, przede wszystkim Państwo słomińscy są bardzo znani w naszej parafii Matki Boskiej Częstochowskiej, udzielają się. Sama miałam, jako prezeska klubu seniorów, miałam przyjemność zaprosić pana Słomińskiego i panią Słomińską. Mieli u nas specjalne pogadanki dla seniorów. Pan jest personel bardzo przyjemny. Pani menadżer, pani Wiola wszystko zawsze załatwia. Jest tutaj dzisiaj i jest tutaj główną dowodzącą, jak gdyby zaprasza pacjentów na masaże.
Witamy ponownie. Chciałam przedstawić panią Wandę Fleszar-Zych, naszą szefową Koła Seniorów Złota Róża z parafii Matki Boskiej Częstochowskiej i naszego wspaniałego gościa dzisiaj. Pani Wanda nam pomoże wylosować nagrody dla naszych gości i mamy 3 nagrody, także będziemy panią prosić o pomoc w wymieszanie wszystkiego i losujemy nagrodę 3, która jest tutaj schowana w tym opakowaniu. Tak, to tak, zdejmiemy. Teraz tak. 3. nagroda. Okej, a wygrał ją pan Ed Kuzia i on jest jeszcze tutaj chyba obecny. Panie Ed, prosimy bardzo. Ed, you won. Proszę bardzo, yes.
You're kidding me.
Oh my gosh, you have to say thank you to
Thank you.
Wanda.
Thank you.
Okay, congratulations. Let's draw right now second prize, and this prize goes to Mr. Mazen Azara. Mazen, our very good friend, and he is not present right now, so we are going to contact him, and what he won is this beautiful picture. Chyba możemy mówić też po polsku teraz, bo jesteśmy, że tak powiem, w gronie polonijnym, tak jest. I teraz nagroda trzecia. A trzecią nagrodą jest gift masaż na gift certificate. To tak, to 2 razy ten sam entry jest not valid, tak jest. Aha, to musi być jedno entry per person. Brawo! Pani Wanda Fleszarsy! Congratulations, to na masaż proszę bardzo, gratulacje, dziękuję. Ale no, ma pani szczęśliwą rękę dla wszystkich, dziękujemy.
Bóle kręgosłupa, urazy po wypadkach, ograniczona sprawność po operacji. Active Rehab Center oferuje kompleksową fizjoterapię narządów ruchu i szeroką gamę masaży dostosowaną do potrzeb każdego pacjenta. Wieloletnie doświadczenie, profesjonalni fizykoterapeuci, najwyższej klasy sprzęt, czas przeznaczony na pytania pacjenta. Akceptujemy większość ubezpieczeń oraz oferujemy dogodne warunki finansowania dla osób bez ubezpieczenia.
Jako założyciel Active Rehab Center zapraszam wszystkich serdecznie do skorzystania z naszych serwisów. Zapewniam najwyższej jakości usługi w zakresie rehabilitacji ruchowej i masażu. Więcej informacji na stronie internetowej www.activerehabcenter.com.
Hello, hi everybody. We've been treated by Mr. Arnold Active Rehab Center in Shelby Township. They are very great provider, and we appreciate their business. So they're very kind and they do the job right and nicely. So that's my family, my children, and my lovely
New
wife.
wife, our old wife is in heaven.
And we could say hi to everybody. All right. Thank you. God bless you.
Hello, my name's Ed, and welcome to physical therapy. And there's great people here as great therapists.
Pani Wanda Fleszarzych, prezeska Koła Seniorów przy Parafii Matki Boskiej Częstochowskiej. Jest to pierwszy raz przed kamerą, więc proszę mi wybaczyć, prawda, małe zdenerwowanie, ale jestem tutaj w Active Rehab Center na Open House u Państwa Słomińskich i chciałam podkreślić, że jest bardzo piękny zakład, nowocześnie urządzony, odremontowany, najwyższa technologia we wszystkich urządzeniach. Jest bardzo dobre przyjęcie, jest sporo osób z naszej parafii. Przede wszystkim Państwo słomińscy są bardzo znani w naszej parafii Matki Boskiej Częstochowskiej. Udzielają się. Sama miałam, jako prezeska klubu seniorów, miałam przyjemność zaprosić pana Słomińskiego i panią Słomińską. Mieli u nas specjalne pogadanki dla seniorów. Pan jest personel bardzo przyjemny. Pani menadżer, pani Wiola wszystko zawsze załatwia. Jest tutaj dzisiaj i jest tutaj główną dowodzącą, jak gdyby zaprasza pacjentów na masaże.
witamy ponownie. Chciałam przedstawić panią Wandę Fleszar-Zych, naszą szefową Koła Seniorów Złota Róża z parafii Matki Boskiej Częstochowskiej i naszego wspaniałego gościa dzisiaj. Pani Wanda nam pomoże wylosować nagrody dla naszych gości i mamy 3 nagrody, także będziemy panią prosić o pomoc w wymieszanie wszystkiego i losujemy nagrodę 3, która jest tutaj schowana w tym opakowaniu. Tak, tak, zdejmiemy. Teraz tak. 3 nagroda. Okej, a wygrał ją pan Ed Kuzia i on jest jeszcze tutaj chyba obecny. Panie Ed, prosimy bardzo. Ed, you won. Proszę bardzo, yes.
You're kidding me.
Oh my gosh, you have to say thank you to Wanda.
Thank you.
Okay, congratulations. Let's draw right now 2nd prize, and this prize goes to Mr. Mazen Azara. Mazen, our very good friend, and he's not present right now, so we are going to contact him, and what he won is this beautiful picture. Chyba możemy mówić też po polsku teraz, bo jesteśmy, że tak powiem, w gronie polonijnym, tak jest. I teraz nagroda 3. A 3. nagrodą jest gift masaż na gift certificate. To tak, to 2 razy ten sam entry jest not valid, tak jest. Aha, to musi być jedno entry per person. Brawo! Pani Wanda Fleszar-Zych! Congratulations! To na masaż, proszę bardzo, gratulacje, dziękuję. Ale no, ma pani szczęśliwą rękę dla wszystkich. Dziękujemy.
Hello, hi everybody. I've been patient with Active Rehab Center from 2007 until recent. I appreciate the business as a good provider, helped me with my injury. So I found the big help to be treated as a patient, and they are, as a therapist and a team, they are very kindly and they're doing their job rightly, especially the appointment be appreciated also, and I wish them the best and good luck for them forever. Thank you.
Bóle kręgosłupa, urazy po wypadkach, ograniczona sprawność po operacji. Active Rehab Center oferuje kompleksową fizjoterapię narządów ruchu i szeroką gamę masaży dostosowaną do potrzeb każdego pacjenta. Wieloletnie doświadczenie, profesjonalni fizykoterapeuci, najwyższej klasy sprzęt, czas przeznaczony na pytania pacjenta. Akceptujemy większość ubezpieczeń oraz oferujemy dogodne warunki finansowania dla osób bez ubezpieczenia.
Jako założyciel Active Rehab Center zapraszam wszystkich serdecznie do skorzystania z naszych serwisów. Zapewniam najwyższej jakości usługi w zakresie rehabilitacji ruchowej i masażu. Więcej informacji na stronie internetowej www.activerehabcenter.com.
Hi, my name is Sarah. I've been having knee problems since I was 14 years old. I've been to 4 physical therapists and had 3 surgeries, and until I came to Active Rehab, nobody was able to help me. Since I got here, I've been able to straighten my leg, which I hadn't been able to do 3 years prior to coming, and I can walk again and haven't been on crutches in over a year.
Hi everyone, my name is Cheryl Voltaggio, and I just wanted to share with you what an absolutely fantastic experience I've had here at Active Rehab. Starting from when you walk in and meeting with the young ladies at the front desk, all the way to working with my physical therapist, Martin. I've also recommended lots of people come here, and I can tell you that everyone's experience has been absolutely fantastic, and I've seen proven results. I would highly recommend that everyone come here for support of any kind. Thank you all and have a great day.
Znam osobiście pana Arnolda Słomińskiego. Wiem, że oprócz tego, że jest bardzo dobrym masażystą, to ma dużą wiedzę, jeśli chodzi o sport, ponieważ skończył Akademię Wychowania Fizycznego w Polsce. I głównie dlatego przychodzę, że ja, mimo że jestem w podeszłym wieku, jestem sportowcem i on rozumie moje problemy związane z urazami, które mam. Próbowałem kilku innych masażystów czy fizjoterapeutów, nazwijmy to, i zauważyłem, że jest szalona różnica między jego wiedzą, jeśli chodzi o anatomię człowieka i jak kontuzje powstają i dlaczego powstają, niż innych. I właśnie dlatego tu przychodzę, bo po prostu czuję, że ta wiedza, którą on ma, jest potrzebna, żeby moje kontuzje wyleczyć. Nie są to typowe kontuzje jak u ludzi starszych, tylko kontuzje, które są dosyć skomplikowane z uwagi na sporty, które uprawiam. I to jest praktycznie głównym i jedynym powodem, nie mówiąc o tym, że cała obsługa jest sympatyczna, a w szczególności pan Arnold.
Przychodzę do kliniki Active Rehab Center, ponieważ dostaję tu bardzo dobry serwis. Znam osobiście wszystkich masażystów, łącznie z właścicielem Arnoldem Stromińskim. Moje schorzenie szczególnie, jakie narzekam, to był mój lower back. Byłem bardzo poważnie chory, nie mogłem pracować. Po paru zabiegach wróciłem do swojego normalnego życia, do swojej aktywności. Polecam tą klinikę wszystkim.